Yes! Probably gonna need this. I really do know nothing about Thursday Island.
Hi, my name is Nardine and I'm a local member of the Thursday Island community. Today my aim is to tell you a little about the island, its history and demographics. So let's start off with where we're located. Thursday Island is a small island in the Torres Strait and is the administrative centre of all the Australian islands between Cape York and the New Guinea mainland. It is considered a Category 5 community, which means it is very remote. Consequently, there is little accessibility to goods, services and opportunities for social interaction. We are situated in the Prince of Wales Island Group, or the Inner Land, 35 kilometres northwest of Australia's northern extremity. In other words, 2,191 kilometres north of Brisbane, 802 kilometres north of Cairns, and 511 kilometres south of Papua New Guinea. Now, moving on to history. Where does the name Thursday Island actually come from? Well, first it is important to remember that the actual name of the island, the one given by the Kurarek people, is Waibin. For thousands of years, the Kurarek people followed traditional patterns of hunting, fishing and agriculture, and maintained close cultural and trading ties with the Aboriginal groups of the northern area of Cape York. In 1848, however, Captain Stanley came as part of the European settlement and gave the island the name Thursday, and two other islands in the area, Wednesday and Friday. Nowadays, Thursday Island is commonly referred to as TI. Okay, so now a bit on demographics. In the 2011 census, there were 2,610 people in Thursday Island. Of those, 49% were male and 51 were female. Aboriginal Torres Strait Islander people made up 64.6% of the population. As we can see in the population pyramid here, the median age of people in TI was 28 years, which is 9 years less than the median age of the overall Australian population. Children aged 0 to 14 years made up 31% of the population, and people aged 65 years and over made up around 5% of the population. The most common ancestors of TI were Australian, followed by Torres Strait Islander people, then English, Scottish and Irish. The religious makeup of TI is Anglican, Catholic, Pentecostal, no religion and Uniting Church. In Thursday Island, most people speak English at home. Other languages include Yumplatok, Kalaukawaw, Creole, Miriam and German.
The burden of chronic diseases among the Aboriginal and Torres Strait Islander people has long been recognised to be increased compared to that of non-Indigenous Australians. In remote areas such as the Torres Strait Islands and in particular Thursday Island, as of 2014, the most common chronic diseases were hypertension, type 2 diabetes mellitus and dyslipidemia. The numbers of patients with these chronic diseases can be shown on the graph. The very high rates of chronic diseases in the Torres Strait make chronic disease management the overarching health priority within the local health system. Infectious diseases also contribute to a significant amount of burden on the health services. These diseases include dengue fever, Zika virus, Japanese encephalitis and other known mosquito-borne diseases which have been contracted and quarantined in the Torres Strait Islands.
A good way of exploring the community uniqueness and challenges of Thursday Island is through the social determinants of health.
In terms of employment in Thursday Island, 63.1% of the population is employed full-time and 20.6% are working part-time, leaving an unemployment rate of 4.5%. The main occupations consist of professionals, administrative workers, community and personal service workers, as well as laborers, managers, and trades workers. The main industries people from Thursday Island work in are healthcare and social assistance, public administration and safety, as well as education and training. The median individual income is around $700 per week, with the median rent being about $115 per week. Now let's shift our attention to education. There are multiple programs and services present for child development, such as early childhood intervention, where Queensland Health teachers provide early interventions to children who have disabilities or have additional needs. There are also language and cultural centers, as well as full-time and part-time preparatory programs. There's about 37 educational facilities spread over the Torres Strait region. We also have the Thursday Island primary as well as a secondary school, and a JCU campus, which was opened in 2003, and it provides teaching and learning facilities for nursing and education students.
While there are no addiction statistics for Thursday Island specifically, Indigenous Australians nationally are more likely to engage in high-risk behavior than their non-Indigenous counterparts. This can be found to be true in regard to tobacco use, alcohol abuse, and illicit drug use. While Thursday Island does not have an alcohol ban, they do have drug and alcohol support groups available for those interested. Thursday Island residents rely on 3 stores for their groceries. Services and prices are generally higher due to freight service costs. Additionally, there are several cafes and restaurants that offer a variety of food on the island. Most visitors and residents returning to TI from the mainland fly from Cairns to Horn Island, where the airport is situated. From there, a bus service transports passengers to the dock, where they board a 30-minute ferry route to TI. There is also an airport in Sisia with services to and from Cairns. Alternatively, there is a road to Sisia that is open during the dry season. From there, a paddles ferry operates twice daily and takes 70 minutes to TI. There is a great deal of local travel, mostly in smaller boats or by water taxi service that operates between other Torres Strait islands. Within the island, the main methods of transport are walking and biking. However, most of the Thursday Island residents own at least one motor vehicle. Additionally, there is an inexpensive bus service available, a car rental shop, and 2 taxi services operating within the island.
Aboriginal and Torres Strait Islander Australians, such as those inhabiting Thursday Island, are far more likely to suffer poverty and social exclusion. Queensland Council Social Services recognises the serious disadvantage faced by Aboriginal and Torres Strait Islander population, people in rural and remote areas, and culturally and linguistically diverse communities. So the living standards on Thursday Island is measured in terms of median weekly household income. Household incomes for Indigenous Australians residing on Thursday Island were significantly lower than the reported Australian average. The median weekly household income for Indigenous Australians on Thursday Island is $987 in comparison to the $1,481 for the Australian average. 26.2% of dependent children from Aboriginal and Torres Strait Island families from Thursday Island were from jobless families in comparison to 12% of dependent children from the Australian population. Moreover, the average size per household is another key social indicator of the Aboriginal standard of living. 34.7% of households in Thursday Island were overcrowded. The average size per house is 4.2 persons per household in comparison to 2.7 in the Australian population. Studies demonstrate that there is a socio-economic gradient in adult mortality, further supporting the consideration of the causal links between status and health. The traditional social structure of Indigenous communities in Thursday Island are based around kinship systems that adopt an entirely different terminology to that of the Anglo-Celtic system. Households of Indigenous people in Thursday Island tend to be complex and fluid in their composition, with kinship networks overlapping and adults and children often moving between households. Greater value is placed on social relationships, their physical and emotional bonds to country, and connecting them to the spirit of their ancestors. The unit of their society is not the individual but the group. Various studies conducted demonstrate that societies that foster high-quality social relationships and social support seemingly produce healthier populations.
And now, onto the healthcare services in TI. We have 2 main healthcare facilities.
The Thursday Island Hospital, which is the main referral hospital for 17 primary healthcare centres of the Torres Strait Islands, as well as our own primary healthcare centre. This provides services for the region, including inner islands, outer islands, and the Northern Peninsula area. But what health services are there? Are there enough doctors? How many hospital beds do they have? Is the community really satisfied with the healthcare facilities? To find out about all this information and more, call 1300 TI, and one of our very own health professionals will guide you through it.
Welcome to Health Services TI. Press 1 for hospital services such as general medicine, maternity, or emergency services. Press 2 for allied health such as pharmacy, radiography, or physiotherapy. Press 3 for outreach services such as occupational therapy, dietitian, or podiatry. And last, press 4 for community health services such as school health, indigenous health, or health promotion and prevention.
Thursday Island Health Promotion, Mark speaking. How can I help you?
I just got a job in TI as a dentist and I'm so excited. I have big dreams about changing oral health in Thursday Island. No more decay, no more gum disease.
Hold up. Not to burst your bubble, but have you actually considered how you're going to do that? I thought so. Well, I can help you. Let me start by sending you a great model that will help you structure your community engagement plan. What's your email?
Okay, perfect. My email is pearlyjohn@gmail.com.
Okay, awesome. Done. Thursday Island Health Promotion, Mark speaking. How can I help you?
Hi, it's me again, Dr. John. I thought about what you've sent me and I have a plan. Okay, so first step is to define purpose and objectives. The purpose of my community engagement plan is to gather information in regards to oral health issues in Thursday Island over a year, and to tailor future service based on the findings that ensure the community needs are met. My objectives are to gain the trust of the community whilst maintaining mutual respect, having clear roles and responsibilities with the agreement to listen, ensuring that the decision-making structures are accessible and transparent. And for the second step, I stumbled across a really good documentary which helped me gain a better understanding of the community profile. However, I will not just stop there. I'm planning to continue gathering a deeper understanding of the community once I've become a part of it. I was also able to have a meeting with Dr. Yassa, who is one of the dentists up there, and we had a very informative discussion.
Well, first, John, it is important to understand why stakeholders are actually so important and how they contribute to your plan. The mapping of groups, organizations, services, and networks can provide opportunities to tap into the local connections and networks. This helps to identify engagement activities and uncovers community knowledge about what already exists, what is working, and what opportunities there are to work in partnership with other organizations. When you're identifying your stakeholders, it is important to ensure a variety of people are included, such as consumer groups, community service organizations, as well as authoritative figures such as government departments.
Okay, Dr. Yassa, can you give me some stakeholders that I could possibly talk to?
Of course, John. Firstly, it is important to include general community members who represent the consumers of oral health services. Dentists such as myself can inform me about the most common oral health issues we see on a day-to-day basis, explain to you the nature of compliance of patients there, as well as discuss with you what has been proven to be the most effective ways of promoting oral health. The Torres Shire Council, it is the local authority of TI and is comprised of a mayor and 4 councillors. Fourthly, the newly elected mayor, Vonda Malone, would be especially helpful as she possesses a graduate certificate in Australian rural leadership, as well as in the public sector management. Moving on, the Torres Strait Regional Authority is an Australian government established to administer the Torres Strait Islands. Furthermore, Mrs. Sharon County, Principal Our Lady and Sacred Heart School, can assist in implementing oral health promotion programs in educational facilities. And finally, I would also like to recommend going to the primary healthcare centre. It has a unique management structure which provides culturally appropriate health services. Would therefore be very useful to learn about the models they follow so you can incorporate them in your management plan.
That sounds great, John. Have you looked into current engagement activities?
I sure have. So in terms of social media, there's the 4MW radio station for the Torres Strait, which gives locals the opportunity to have a voice and share their culture. There's also the Torres Strait Island Regional Council Facebook page. They have the Gab to Chewy Cultural Centre, which is operated by the TSRA and a board of Indigenous members representing 20 communities in the Torres Strait. The Winds of Zanath Cultural Festival is another major event. School programs such as Straight Start are community-driven and focus on parental engagement and building local capacities with outreach visits to family homes. They also have a sports complex which is run by the Torres Strait Youth Recreation Sporting Association, dedicated to support and strengthen the Indigenous communities.
Great. So what are your priorities?
So, to place individuals at the centre of their own health and well-being, and to build capacity to achieve these outcomes, to work with communities and to understand local needs and design and implement solutions to improve local health, and to ensure integrated approach in health and well-being.
It definitely sounds like you're on the right track, John. Where are you going to go from here?
Well, I was also able to get a hold of Mrs. Potter, who has been involved in various successful community engagement activities.
There are different levels of engaging in community. This includes informing, consulting, and collaborating. However, John, it's important to realize that these do not necessarily have to occur in order, but actually work most effectively when done simultaneously. The first level of engagement is to inform. While this is a one-way relationship, it allows a message to be sent to a large audience in a short amount of time. This information will allow community members to understand what you'll be doing in the community and give them the opportunity to participate if they wish.
Ooh, for advertising, I could use local radio stations and Facebook pages to increase the awareness and provide information for people on where they could go to take part in engagement activities.
That's right. You could also take part in community events such as the Winds of Sedith Cultural Festival, which is a major event of the year. Maybe have an information stand to allow people to ask questions, participate in activities, helping to further build a strong relationship with the community. This will increase the approachability of your oral health team, and since events are often attended by a wider variety of people, you'll be able to reach the outer communities beyond TI. For education and awareness programs, you could visit local schools, the TI Sports Center, and participate in Straight Start to teach children about effective oral hygiene habits. Fact sheets and toothbrushes can also be sent home to extend the target audience.
Oh wow, that sounds great.
The next step is consultation. Not only do these processes help build two-way relationships with the public, but in doing so helps explore a wider range of options and gather community feedback.
Well, maybe I can use internet-based forums and start discussions on the Facebook page to get community opinions on oral health issues.
Well, yes, but although this may be appealing to individuals who do not wish to participate in group events, it is limited to those with access to the internet. You could organize focus groups that could be open to the general public. This encourages active discussion and innovative ideas, as it allows opinions to build off one another. It's important to be aware that participants may not represent all parts of the community equally, and not all participants may be comfortable with sharing their ideas. Lastly, John, let's discuss collaboration. Advisory committees are great for active participation. They can be made up of stakeholders who represent the broader group of TI. That way, you can be certain that the ideas are in the best interest of the community. They can provide ongoing input and support and ensure that plans are actually getting executed. Another successful method is charrettes, which includes hands-on workshops whereby members come together to discuss issues, share desired outcomes, and work together to create plans for the future. The primary health center would be an ideal location for this workshop, as it involves a broader range of health professionals with various areas of expertise. That way, oral health is incorporated as part of a general health promotion approach rather than just treated as an isolated issue.
Well, this is all well and good, but do you realize that the Indigenous community makes up a big proportion of our population? Have you considered how you're going to involve them in your engagement plan?
Well, of course, they play a big role. I'm hoping to have the council as one of the stakeholders. Not only are they all of Indigenous origin, but they have also been involved in various Closing the Gap initiatives. I'm also planning to have Indigenous representatives at all of my community engagement events to ensure that they are all culturally appropriate and attractive to the Indigenous community. To overcome the language barriers, I will advertise through the local radio station, since the programs are mostly in the Creole language.
Perfect. Next, you need to ensure that the activities go as planned and that you actually achieve your goals. Ask the community these key questions. Is the plan that you have created appropriate for Thursday Island? Was it culturally sensitive? And do they feel like your plans and goals are realistic? Then look at your performance indicators, like how many people visited the Facebook page, how many people listened to the radio station, and how many people came to the stand at the festival. Also, how many people did you interview? Before putting any of these strategies into place, you must consult with the community and gain their permission and trust as well. For example, like a short spoken presentation to the council or printed pamphlets that is given to the community. You also need to monitor, review, and evaluate your community engagement plan. This can be done through monitoring the outcomes and performance indicators, as well as giving feedback to the stakeholders and community. Also, announcing key findings in different languages. An ongoing evaluation can be done through short surveys at community events or after roundtable discussions with focus groups. People can rate how useful they found the sessions and their expectations of how soon they expect change.
Okay, so I should make sure that the information gathered from surveys and questionnaires should be placed in weekly or monthly reports and given as formal presentation to local council members and be designed as a pamphlet for the community members, right?
Yeah, I think you're ready.
Thanks so much, Mark, for your help. I'll see you up there.